All right. Good morning, afternoon, whatever time it is. This is the pre-recorded lecture for personal and professional qualities for healthcare workers. This is going to be split into a couple of different videos. Okay. So I've got my pointer turned on so you can see where I'm obviously pointing to. Amazing. All right, so learner objectives for this content, and this is for the entire chapter over personal and professional qualities, everything that we're going to learn about for this particular chapter. These are the learning objectives for that. Okay, so you're going to be able to identify both good and bad personal and or professional qualities that somebody might have, okay, and specific ones that are needed for the healthcare field. Now, granted, a lot of them kind of overlap depending on uh, what profession you're going into, but for the most part, there are some that are specific for just healthcare. Okay, so you're going to be able to identify good and bad qualities. You're going to be able to identify qualities within yourself. Okay, so what are things that you're really good at, and what are things you're not really good at and need to improve on? Okay, you're going to be able to write a professional email. Okay, so you're going to be sending me an email. That's going to be one of your assignments. Okay. And we are going to look at how do you write a notice for quitting a place of employment, okay? And then we're also going to look at different resumes and seeing if they're good or if they're bad and what makes it good or bad, okay? And then you're going to be able to write your own professional statement. So in this point in your life, most of y'all are freshmen, not all of y'all, but most of y'all are freshmen, and you need to go ahead and start looking at what kind of career do I want to do? What job do I want to do for the rest of my life? So be kind of considering that and looking at that. You don't have to have anything set in stone. I can tell you myself, I did not stick with my career option even through college. So it's okay to change your mind, but you have to have kind of those thoughts and those conversations even with yourself of what do I want to do? Okay. So obviously with you being in this class, hopefully, maybe, your preference tends to be towards healthcare. So just what specifically do you want to do? So we'll look at that when we get there. So personal appearance. Okay, so we're going to talk about that. Okay, so looking at these children here, looking at this man here, and looking at these ladies here, can you tell me what they do or who are they? Okay, maybe not like name, like we don't know who they are, but can you tell me something about them based on their look? Okay. So hopefully you kind of guessed, okay, so these kids are in uniforms and they're obviously kids. So maybe you jump to the conclusion that these are students that are in some sort of um, school that requires uniforms. Okay? And this middle guy here, okay, so you pick up that he has on a uniform, he's got on a hat. There's a couple of things you could think of, possibly military. This guy's actually a pilot. Okay, so if you look really closely, right here, you see a set of wings right there. So you know that this man is a pilot. Okay. So again, just based on looking at him, you can kind of come to that conclusion that he's a pilot. Okay. Now, these ladies over here, you might ask yourself, who are these ladies? And this is a group of nuns. Okay. So they're not in their traditional black and white, but these are still nuns. Okay. So just based on looking at these individuals on this slide, you're able to figure out who they are. Okay. And that is very important because when we're talking about you in your field of work, for the most part, you're also going to have some sort of uniform that is going to signify who you are. Okay. They also come off as professional as well, just based on their uniform and that they're dressed alike and that, they look nice, things like that. So that's a combination of personal appearance along with their professional appearance as well. So let's kind of move on from here. Okay. So I'm going to want you to type into a response here. So if you're in present mode, you're going to have to minimize it, go back to like as if you're going to edit it. And you're going to be able to type in this box. So you're just going to kind of highlight that and type in this box. Okay. So for personal appearance, I want your first impression on this man right here. Okay. So take a second, go ahead and minimize it. Take a second and type your response of what is your first impression of this man? What do you think he does? Who do you think he is? Just sort of first impression. If you saw him walking down the road, what do you think he is? Are there any other things that come to mind when you look at him? Okay. So go ahead and take a second, pause the video, take a second and answer that question. Okay, so now that you have answered that question, I'm going to show you a second picture. And you're going to type in the same box with this one, okay? So now look at this man, okay? This is actually the same guy. He's actually a doctor, okay? So if he had his sleeves unrolled and all the way down, you would not be able to see his tattoos on his arm. And he's got obviously no like radical crazy kind of piercings on his face, and he has no facial tattoos or anything like that. So if he had his sleeves all the way down, you would not see his tattoos. You would only see his white coat and his stethoscope. So what would be your impressions if you were to like cover up this man's arm and not see that and just see this man standing here? What would your impressions of this guy be? Okay. And how does it differ from your impressions of this guy? It's actually the same man though. Okay. So in his spare time, if you didn't notice this to begin with, he's got a stethoscope still wrapped around his neck right there. It just kind of blends in because of what he's wearing. Okay. So depending on what your personal life is like, you can still be a professional. I know a lot of people say, tattoos, that means that you're unprofessional. And that's not true. Okay. You just have to know when you need to cover them up. You have to think about that when you get them. Okay. So try not to tattoo something right across your forehead. But other than that, like you can still, live your life. You can still express yourself the way you want to, but you just have to understand that there's going to be times when it calls for that professional appearance. Okay. I don't wear super nice clothes all the time. Okay. I love jeans and a t-shirt. I like shorts and a t-shirt. But obviously when I'm at school, when I'm teaching you guys, when I'm in my kind of nursing realm, I'm obviously wearing something that kind of coexists with that. It's not necessarily that it's different. Okay. So type your impressions of what you thought about first when you saw this man, and then your impressions of when you saw this guy. Okay. And maybe how you adjusted your thinking based on what he was wearing. Okay. So your personal look is going to kind of change how you present yourself. Okay. So as a future healthcare worker, you have to understand that your job includes to promote health and good habits. Okay. Regardless of where you're in, you could even talk about dentists as well. You have to understand that you as a professional has to kind of promote this. Okay, so you can't be doing one thing and telling your patients to do another. Okay, they're going to see you as a hypocrite and they're not going to want to come back to you. Okay, so you have to make sure that what you tell them is what you're doing in your own personal life. So don't tell your patients, sorry, you can't smoke anymore because that's bad for your health. And then when they leave the clinic, they see you out taking a smoke break. Okay, you can't do that. So you have to make sure that you are reflecting what you're teaching your patients. Okay. So a healthy appearance. Okay. So a good diet, getting the proper amount of rest so that you don't have the dark circles under your eyes and you look like you haven't slept in a week. Okay. Making sure that you're getting your proper exercise so that you don't have to look like a fitness model. I'm not saying that. I'm just saying that you at least have to, if you're going to be promoting exercise with your patients, then you're going to have to do the same for yourself. Okay. Correct posture. And you don't have to all the time. I mean, I'm really guilty of that. I tend to slouch over all the time. So being mindful of that is also going to be part of it. You don't want to sit in your chair all the time like this. You're like, oh, next patient, come in. You can't do that either, okay? So you've got to be sure that you are kind of in that, not necessarily presenting mode, but just that you are making sure that you're promoting that good health and get those good habits, okay? And the last one here is to avoid the use of alcohol and drugs and tobacco, okay? So again, not at your age, not at your age. You're not 21 yet. You're not at your age, okay? You shouldn't be consuming alcohol anyways. And if we have to talk about that, we'll talk about that, okay? But at your age, you're not drinking alcohol, okay? But once you get to that point in your life where it's legal and you can drink alcohol, just don't go overboard. There's no reason to, okay? You're just hurting yourself and possibly others. So there's no point. So I mean, you can drink alcohol socially after you turn 21. But there's no reason to go overboard with it. I mean, nobody should be doing drugs anyways. I mean, regardless, across the board, nobody should be doing drugs. And so that's not something that we want to promote. And then tobacco, you also don't want to be a smoker or using tobacco products, period, whether that's, snuff, whatever. Okay. Again, in the medical community, we understand that tobacco products are not good. Okay. So we obviously don't want to tell our patients you can't use tobacco when you're using tobacco yourself. When I used to work at ETMC, which is now UT Health East Texas. I don't know. It's not Mother Francis that's in Tyler. It's the other one. Used to be East Texas Medical Center. When I worked there, they would test you for tobacco. If you had tobacco in your system, you would be fired. Okay. So as you came in to come to work, like when you got hired on, you had a little box to check that said, do you use tobacco products? Yes or no? Because we are a tobacco free, like employees are tobacco free, like doesn't matter personal life, outside of hospital, doesn't matter. You cannot use tobacco. I thought that was pretty cool. So if more hospitals and more organizations are going to go towards that, then obviously tobacco products, you can't use them. So don't get into the habit of it now. Okay. So another thing that I just want to kind of hit on is if you don't have that healthy look, okay, again, I'm not saying fitness model anything, but if you don't have that healthy look, does that mean that you can't go into the medical field? Absolutely not. Okay. I'm not saying that. But do you need to be aware of the impression that you're giving people? And do you need to be working on it yourself? Yes. Okay. So I'm not saying just because you don't have the look doesn't mean you can't go into the medical field. Not what I'm saying. Okay. But you have to be able to make those changes. Okay. All right. So professional appearance. So these are the things that the company or wherever you're working is going to make you wear or do. Okay. So the first thing you usually talk about is a uniform. So whether you're talking about like a doctor doesn't really have a uniform, but the thing that kind of distinguishes them is their white coat. Okay. Now, do all doctors wear their white coat? No, they don't. It's not mandated that they wear a coat. It just sort of distinguishes them as a doctor. Okay. Now, as nurses, like I said, I used to work at the hospital. So I had to wear scrubs. And, you've seen all the cutesy scrubs that have like the little like cartoon characters and stuff on it. You can't wear that. Okay. Most places, when you go and work at a hospital or a clinic or something, they want you all wearing the same color. Okay. And if it's a very specific color, you have to get a specific brand. Okay. And it could be the really crappy brand. Okay. So, it, don't get used to that. Oh, I can choose whatever I want because you're probably not going to be able to. When I was going through nursing school, I had to have a particular color of my uniform because that distinguished me as a nursing student from a particular nursing program. So, a lot of those choices are taken away. So like on my floor, Again, this was ETMC, so it was a different color scheme. We had kind of this green blue kind of color that all the nurses wore, so that when you saw somebody from down the hallway in that greenish blue color, you knew that that was a nurse. Okay. If you saw anybody in black, you knew that they were from lab. They were from imaging. So, like people doing your x rays and things like that. If you saw red, they were from laboratory because they take your blood. That was very clever. Anytime you saw anybody in blue, that was respiratory. So you could see them from far off and know exactly who they were. And that is the purpose of why they make you wear that particular uniform. So depending on what you do, your uniform is going to be different. Okay. Name badges and IDs. Okay. So if you are tired of these, if you're tired of these, I'm sorry, they're not going away. You're going to have these for the rest of your life. So get used to them. Okay. So like as a nurse, you have to wear it, and you have to wear it like up here. So it's like the little clippy thing up here somewhere so that they can see you. And they know who you are. They know that you're supposed to be there. In some places, like as a nurse, like you have to have the big RN underneath it to make sure that people know that you're a registered nurse versus like an LVN or something like that. But you have these name badges, okay? Just like the name badges now for the school system that you can, it scans so that you can get into different buildings. Our name badges at the hospital did the same thing, so we could get into like supply closets and different parts of the hospital that are cut off to patients so that we could get into different places. So it's a security thing to make sure that you're supposed to be there. It's a place to display your credentials to let people know that you're a doctor or that you're a nurse and what kind of nurse, or that you're respiratory and you're a therapist or whatever. So it has to be somewhere up here. Okay. So just get used to them. Know that you're going to have them for the rest of your life. Okay. So again, some people are not going to require that you do a uniform, but you have to have professional clothing. So like our doctors, they don't have to wear something specific, but they're wearing slacks and a nice shirt, whatever. Okay. So just know that you have to dress professionally. And again, professionally is not, it looks wrinkled or anything like that. And make sure that you're not dressing to go to a club or anything like that. You're not trying to show your goods off. You're just trying to look professional. So flattering, nice clothes that look like they haven't been sitting in the corner of your room for a week, and that they're professional and they're modest. Okay. Okay. Appropriate shoes. Now, this sounds weird, but depending on what you're doing and how you're working, you can't just say you need a nice pair of shoes. You can't wear, guys, you can't wear like really nice dress shoes and then work in the ER. Okay. You can, but you're going to need some shoe covers because you have no idea what's going to splatter on there. Vomit, blood, poo, whatever. Okay. You've got to make sure that they're appropriate. Okay. So heels, ladies, when it's appropriate, maybe as a doctor, but understand that you're doing a lot of walking. So they better be some comfortable heels. For like nurses and stuff, you're in tennis shoes because you're doing a heck of a lot of walking. So make sure that they're comfortable. So no flip-flops or Crocs or stilettos that are like 8 feet tall. Okay. You don't need all that stuff. Again, you're not there to make a show of yourself. You're there to help and you're there to be productive. It's not, I'm in a fashion show. Okay. So just make sure that they're appropriate and for your work. Okay. Sometimes it's also like protecting your toes to make sure that they're not going to be smashed or run over by a hospital bed or anything like that. Okay. So the next thing, neat short nails. I'm sorry, ladies, and some males. I know that. Okay. You're going to have to keep your nails short. Okay. None of these long, those are even called stilettos too. Nails with all them frilly little designs on them, and like the ones that look like they can, you could just like stab somebody in the neck and kill them. None of that. These are my nails. I don't know if you can see that all the time. They're short. Okay. I don't like them any longer than this. It drives me nuts. Okay. So the question would be, why do they need to be short? you harbor all kinds of bacteria and nasty stuff underneath your nails all the time. And trying to keep that clean is not easy. Those fake acrylic nails will, because they're sticky, sometimes they're sticky on the bottom side of it, and that will also pick up and grab a lot of bacteria and things like that. Now, can you paint them? Some people are really specific. It kind of depends on where you work. If you're in surgery, you cannot have painted fingernails whatsoever, not even clear coat, okay? Because those fingernails can chip and get into places they're not supposed to. So you need to make sure with your hospital's policies. Sometimes they don't even want you messing with patient tubing, so like IVs and stuff, if you've got paint on your nails. So just make sure that you know that. I was never a big frilly girl that did my nails. They probably chipped like 2 seconds after I did them anyways, and that just frustrated me, so I never really did painted nails, okay? And I always liked them short. I was never a curl my nails out anyways. So just know that you're gonna have to keep them short, okay? Clean managed hair and facial hair, okay? So if you've got really long flowy hair, that's cute. You can be an Instagram model later, okay? But at the hospital, you've got to be functional. If you're leaning over a patient, your hair is like in their face. One, that's not clean and sanitary, and two, they're not going to like it anyways. So just make sure that you are kind of keeping that up and out of the way. So whether that's in a ponytail or up in a bun, ladies, guys, you also have man buns. Up and out of the way, headband, something to keep it out of your face, okay? So just, you don't want it dragging through places. If you're cleaning up vomit, you don't want your hair getting into it. That's nasty. And then guys with facial hair, just make sure that it's clean, okay? It's okay that you have a beard or a mustache or something, but just make sure that it's not dangling all over the place. Just like the ladies, they can't have their long hair dangling and stuff. You can't be, dangling in people's faces either, because it's disgusting. Okay. Minimal jewelry. You can't go bedazzled into the hospital with all your bangle bracelets and things like that. You can't do that. So just like a wedding ring, if you have one, those cute little rubber band type groove ring type rings that they have and stuff would be awesome. You don't want to have to worry about it getting pulled off, getting broken, getting damaged in any way, but also show that you're not single anymore. So you're like your wedding rings, maybe a simple necklace, but not like a whole, giant thing. Okay. So just like a simple little necklace. And then maybe some small earrings, but no bangles, no rings on every finger, not enormous chains, sporting household objects, no dangling earrings, none of that business. Okay. Save that for later, not while you're in the hospital, okay? So just make sure that you are kind of aware of that. And the last point, I'm gonna have to move myself. Maybe I can stick myself over here. Oh, all right. Reasonable makeup and tattoo coverage, okay? Does that mean that if you don't wear makeup, you have to? No, okay? I'm just saying that if you are going to apply makeup, make sure that you don't have it like with your cat eyes and like overly done. It just can put people off. They're not there. Again, you're not there to, you're not performing on a stage or anything like that. They don't need to see your makeup. Just make sure that it is, decent. Don't go overboard. You don't have to have the smoky eye look every time. Okay. And then with tattoos, it just kind of depends on where you're at, where you're working. Most times ERs, they don't care. Most of the people that are going to be tatted are going to be down in the ER. For whatever reason, those things go together. Other places, they don't want you showing off any tattoos that you have. So like if somebody has like a sleeve or something, then they actually have to put one of those tattoo sleeve things on in order to cover it, or they're going to require you to wear long sleeves or something like that. Anything to kind of cover those up. So just be sure you kind of know what profession you're getting into and do they care about tattoos before you start tatting yourself up. Okay. Another thing that I wanted to hit on is hairspray and the use of like cologne and perfume. Okay. So hairspray, if you're trying to keep your hair managed, don't use the entire bottle of hairspray, okay? Because you're going to still be giving off that smell. Your head is now flammable, things like that. Just be sure. Smells are not good for patients, depending on why they're in the hospital and things like that. That can bother their allergies and things. I've actually, when I was working in the hospital, I actually had a patient request to have a different nurse because that nurse had put on perfume and it was bothering the patient. Okay. So just be sure. Again, you're not there to set an impression of, hey, I'm available type thing, anyways. So just make sure that I mean, please use deodorant, but don't bathe yourself in cologne or anything like that because that's going to be too much for them. Whether they have allergies, asthma, nauseous, they just don't like um, the scent, anything like that. Just make sure that you're aware of that. All right, moving on. Possibly, maybe. Here we are. All right. So personal characteristics. So we're going to talk about these. This is going to be your first assignment. Okay. So as I talk about this, again, if you minimize and come out of presentation mode and you can see like your main Google Slides page, down at the bottom, you should have speaker notes down just below this slide. You should have speaker notes down there. And I have already typed out all of the words that are on the slide, but it has like a little dash and then there's nothing behind it. Okay. I'm going to be talking about these different characteristics. You can also Google them just to give yourself a kind of a definition. Now, some of these you know, and some of these you don't. So you might need to write them down. If you already know what it is, just kind of type out a quick definition. If you don't know what it is, listen. So when I tell you, you can write it down. Okay. Because this is going to be, like I said, used for your assignment. Okay. So the first one, empathetic. So empathy is something that as a healthcare worker, you have to have empathy. Okay. And empathy is the ability to understand and share feelings of others. Okay. So you have the ability to understand how somebody else feels. Okay. This is different from sympathy. Sympathy is, I pity you. Oh, I'm so sorry. This bad thing happened to you. That's so sad. Okay. You come off sounding arrogant and like a jerk. Okay. Empathy is, I can't understand what you're going through, but I'm here to help you, things like that. That's empathy. And that comes off a lot different than sympathy does. Okay. Honest, being truthful, you understand that. And as healthcare workers, obviously, we have to be honest because um, we have to let our patients know what's going on. And we'll kind of talk about honesty a little bit more when we get into ethics and how honesty and ethics can sometimes contradict each other. So we'll look at that. Okay. You have to be dependable, and dependable is being trustworthy or reliable. Okay. So if you are to work a specific shift, are you going to actually be there, or we going to have to call and find you? Okay. So dependable, we know you're going to be there. We know you're going to do a good job, things like that. Okay. The next thing is willing to learn. Okay. You have to have a desire to acquire knowledge at all times. Okay. I'm sorry, but in the healthcare field, even after you go through schooling, we'll look at this when we get to careers. It doesn't matter how long you spend in school. You can be a doctor and have spent 12 years in college. Guess what? You have to do continuing education hours where you still have to learn. Okay. So you have to have that drive to learn more about your field of whatever it is that you're going into so that you can share that knowledge with others, because healthcare is a field that's constantly changing. There's new data coming out. So you have to be willing to learn. Okay. You have to be patient. I'm not saying you have to be a patient, you have to be patient. And patient is the ability to tolerate delays, problems, setbacks without getting overly annoyed and anxious. Okay. So if something is not working correctly, you're not throwing whatever that is across the room. You got to be patient. Okay. So you have to make sure that you are allowing yourself to kind of cool off in between things if you're getting kind of worked up. Okay. So you have to be patient. You have to be patient with your patients because sometimes they don't want to listen. Sometimes Whatever is going on with them is kind of, they're thinking about it a lot. So they're not really hearing you, things like that. So just be patient with your patients. Okay. The next one is accepting of criticism. Okay. Not a lot of people want to accept criticism, but here it is. Okay. Now, criticism is the ability to handle negative feedback and grow from it. Okay. So I'm not saying that if I was your supervisor on in your job, I wouldn't be saying, that was the most horrible thing that I've ever seen, and you suck at what you do, and you should just quit now. Okay. If you're getting that kind of feedback from somebody, that is not that's not helpful. That is just rude. Okay. And you need to report that person. But if they're saying, hey, okay, so we didn't quite do what we needed to do during that, code, that patient stopped breathing and we needed to do CPR. So we're in the middle of a code, you know, your compressions were a little fast. So let's work on that. Let's work on, getting the compressions at a good speed. That would be good criticism, effective and productive criticism. That's not going to be, that they're just like, you should never do this again. That's just rude. Okay. But you have to understand that you're not going to be perfect. Okay. So you have to know that there's times when you're going to have to grow. So having that kind of feedback is good. Okay. Think of it as I'm growing, I'm getting better, not as I did something wrong. Okay. The next thing, you have to be enthusiastic. Okay. If you come in as a doctor, nurse, whoever, I always use doctor, nurse just because, well, it's easy. But whatever field you're going into. So say if I was your nurse and I was like, yeah, what do you need? Yeah, I'll get that for you. I mean, am I being rude? Not really. Now, I'm not saying you have to come in and be like, good morning, like, it's such a lovely day. Let me get you everything that you need. You don't have to be like overboard, but you have to be like, hey, it's nice to meet you. My name is, I'm your nurse for the day. My name is Miss, is Jennifer. Like, let me help you out. Like, is there anything else I can get for you? Just being at least enthusiastic. You don't have to be like a theater production, okay? But you have to be able to at least not just be like, yeah, okay. That would be boring. Okay. All right. You have to be self-motivated. And self-motivated means that you have the ability to keep yourself going and moving when it might not be optimal or easy. Okay. And again, this is self-motivated. So this is not that somebody is pushing you. A lot of times in school, when you have a particular assignment due and some lovely teacher is like, hey, have you done it yet? Hey, have you done it yet? Have you done it yet? Have you done it yet? Have you turned it in? Have you turned it in? That is not self-motivation. That is somebody motivating you. Okay. Even your parents can sometimes be that way. Have you done this? Have you done that? Have you cleaned your room? Have you, washed your clothes? Have you done this? Have you done that? That is also motivation from somebody else. You have to be motivated. Have I, passed out medications for today? Have I, checked on all of my patients in the last hour? Have I, done this assessment on somebody? It doesn't matter what you're doing. Have you done those things? And that's, you have to do it yourself. It's not somebody, have you done it? Have you done it? Have you done it? Like nothing like that. Okay. Tactful. Okay. So tactful is one of those words that a lot of people don't know what this means. Okay. Being tactful says that what you say is appropriate and sensitive to others. It's saying the right thing at the right time. Okay. So let me give you some examples of somebody who is not tactful. Okay. Say you are moving a patient from one bed to the other. Okay. So for whatever reason, they're being transported somewhere and you need to move the patient from this bed to this bed. Okay. Now your patient, okay, weighs 500 pounds and you are not able to move the patient by yourself. You have another person in there, but you're still not able to move the person. So you need some additional help. Now you could go to the door, open it, and scream out to everybody that's standing out there, hey, we got somebody in here that we can't move by ourselves because she's really big. Like, can we have some help in here? That would not be an example of being tactful. Also, like if you had a patient that just died and the family is standing nearby, something that also wouldn't be tactful is to be like, all right, so what do you want to do with this dead guy? It's also not tactful, okay? So again, saying the right thing at the right time, being sensitive, and being appropriate when you say it, okay? So do you have to shout into the hallway that you need additional help because the patient is large? No. You can just say, hey, I need some extra hands in here. So that everybody else that's in the hallway doesn't know why you need extra hands or extra help for anything. They just know that people are needed in that room and that's it. Okay. So that's being tactful. Okay. I'm sure you enjoy all of my demonstrations. They're point on. Okay. Being competent. This is also another thing that a word you don't normally hear in everyday language, but hopefully you'll learn this word. So being competent means that you have the necessary skills to perform your job. Okay. So that you have the skills, the ability, the knowledge, anything to perform a particular task. So as a nurse, I am competent to do my job as a nurse because I have been trained. Okay. I know how to give a shot. I know how to start an IV. I know how to put in an NG tube, which is a tube that goes up your nose and down into your stomach. If anybody wants to volunteer, I got you covered. So that is being competent, okay? You know how to do those things and that you can actually do them, okay? So that it's competent. So you have to be able to know how to do your job. Yeah, okay. Moving on. So you have to be responsible. So the ability to be trusted to do the right thing or whatever is required, and you don't have to have somebody over you saying, remember, you must do the right thing. Okay, so you have to be responsible. Can you take care of multiple patients at one time? As a nurse on a medical surgical floor, which is a general floor, it's not something that's very specific. We got patients, all kinds of patients, heart patients, lung patients, kidney patients, liver patients. It didn't matter. We had people that came in with gangrene. You don't know what gangrene is? I'll just tell you because if you Google it, you might get images that you don't want to see. But gangrene is when tissue is dying because blood flow has been cut off. We'll look at pictures later. They're my favorite. Can you be responsible for multiple patients? Like I said, I worked on a med-surg floor. So I had 5-6 patients that I was responsible for a 12-hour shift. It was me and that patient. And if something changed with that patient, it was my responsibility to call the doctor and say, hey, something's up with your patient. Because guess what? Doctors get paid the big bucks, but who's the one who keeps them alive? Nurses. Just so you know. So making sure that you are responsible, that you can handle that, okay? The next one is use discretion. And using discretion means that you are deciding or acting according to your own judgment, okay? So, again, as a nurse, figuring out which IV needle size to use. Do I need to use a really tiny IV? Do I need to use a bigger IV? Okay. So, like, if I knew that they needed blood and I knew I was going to be giving blood, I'd have to do a certain size needle because something too small would not work. Okay. So, that is kind of using my discretion, using my knowledge to make a judgment call. Okay. Moving on, professional, we're kind of talking about that, but conduct, behavior, and attitude that are in line with a particular job description. Okay. So just kind of that professional, like look about you, the professional, like the way you act, that you're not calling people names because you're upset with them and you're not acting like a toddler, any of those things. That's just being professional. And the last thing is being a team player. Can you work with others in a positive way without taking over and saying, hey, you're incompetent idiot, let me do everything? Okay. Think about how you work in groups on projects. Are you the taking over? Are you the person that sits back and does nothing? Or are you the person that's trying to get everybody together? Okay. So if you go into Google Classroom, you will see that you have this reflection assignment there. And you are supposed to be looking at the characteristics that we had in the last slide. So all those characteristics that we just went over. And I want you to kind of think about yourself. Are there characteristics that you have? Are there characteristics that you don't have? Okay. So look at that and say, okay, am I empathetic? Am I somebody who can relate to others? And if you can, great. Okay. So that's a characteristic that you possess. If you're not empathetic, if you're kind of those people that are like, well, that sucks for you, but okay, one, either you need to work on that, or two, you don't need to go in the healthcare field unless you're going as a EMT or paramedic or working in the ER. So just make sure that you are aware of yourself, what kind of characteristics you possess versus the things you don't. Okay. So what do you possess? What characteristics do you have? What characteristics do you need to work on? So let's say I'm not a very patient person. Well, I need to work on that because I can't get impatient with my patients because they're not listening to me. I can't like strangle them because that's illegal. So things that you would need to work on. Okay. So like I said, this reflection assignment is already in Google Classrooms. Just go in there, click on it. And it has it where you fill it out. It already has the characteristics in there so you can see them because I'm nice. So just go ahead and do that assignment. And that is what you're doing for today. All right. That is it. We will talk more about communication in the next one. And I'll see you then. Bye.